work of the chamber in supporting businesses, and that has carried through to quite a bit of advocacy work as well. It's been really helpful for policymakers to hear from a whole industry group rather than individual businesses when they're trying to determine their next steps. And the webinar today really came from concerns and questions that a number of our industry work groups had around employee testing. What to do if a staff member or customer is positive, what resources are available to help with testing, what are the new regulations in regards to staff members needing to stay home for a multitude of reasons related to COVID. So we have an absolutely incredible lineup of presenters today. It certainly was not an easy feat to find a time that worked for all these experts, and I want to take a moment to thank you all for making the time in your very, very busy schedules. Thank you. With that, I'd like to introduce our presenters. First, Dr. Brian Harrington, Routt County Public Health Medical Director. Roberta Smith, our interim Routt County Public Health Director. Sonia Fiddler, UC Health Yampa Valley Medical Center President. Lori Japp, UC Health Vice President of Urgent Care and Employer Solutions. Dr. Michelle Barron, she's with Infectious Disease at UC Health. And Tina Harkness with the Employers Council Northern Regional Office Director. So since we are tight on time, I am going to just jump right in, and we're going to start with testing. If we could start, Roberta and Dr. Harrington, can you guys talk with us about process for employers when an employee tests positive, as well as if a customer tests positive and they notified the business afterwards?
Right, and thanks everyone for joining today. And you know, with employee testing, if we do have an employee that tests positive, one thing that I want employers to keep in mind is having policies in place where you can have sick leave. You know, we don't want this person coming to work sick. We want them staying home and to be isolating. When a person tests positive here in Routt County, we do give them isolation orders. So we talk to them when their symptoms started, you know, when they were tested, if they were asymptomatic, and then we will give them a 10-day isolation time that they need to remain at home. So employers, I think, need to be aware of this because we are asking that employee to not go to work and to stay home. We've had some instances where we've had people say, well, I need to go to work because I'm the only person that can do this job. And so it's my recommendation to employers is making sure your employees are cross-trained for that. So if we do have an employee that has to stay home, that there is coverage and we're filling those gaps in those areas. So again, that incentivizes the person to stay home. Once we do have a positive case, we do initiate contact tracing. So we may be calling the employer to get lists of, you know, who was working with the person at that time. We do interview the positive case to understand who their close contacts were and who they've spent time with, where they've gone and where they've traveled. So that might include other people that need to be quarantined from your workplace as well. So, you know, I would say to employers, when you get a call from Routt County Public Health to really help us out in that effort. And, you know, those lists that we are keeping will be helpful at that time. Hopefully we don't have to go to that. I'm thinking on the optimism side, but definitely work with us and understand that there might be some more employees that have to stay home from work.
And I see a question about where you get tested. So you have several options here in our community. Just about all the 8 clinical facilities and the hospital in town in Routt County have the ability to collect tests. So you can contact your primary care clinic. Most of the clinics will collect tests most days of the week. The hospital, since we've started this pandemic, has stood up a test collection site for the community. and that's been available Monday through Fridays. And you can actually order a test without having a doctor's order. I think we're going to talk a little bit about the prioritization of testing during this webinar, but you still have that ability to even do it without a doctor's order. But all the clinics now have the availability to collect tests. And then there's an issue of where the tests get run. And I'm talking about PCR testing. That's a molecular test that requires reagent to amplify viral RNA, then turn it into DNA, and then we can match it to the virus. That requires a highly complex lab to do. We do not really have that ability in our community. Those tests, regardless of which lab, get sent out of our community. And that's involved LabCorp, Quest, the hospital systems, and the CDPHE lab. Consistently through this, UC Health and our local hospital have been running the fastest by far on this, usually about 48, 72 hours, and I'll let them comment on that further. Some of our other tests, so including the state lab, have run out a week, and we're seeing that right now. So we're still kind of challenged with turnaround time, but the collection of tests in our community should be relatively easy.
Thanks, Dr. Harrington.
Kara, there's one more question about that. Someone asked if we could talk about whether a person should be retested after self-isolation.
Right, and yeah, the CDPHE just came out with some guidelines. You know, definitely it's not recommended to, you know, test negative to go back to work or having that criteria for sure. We are seeing people that are persistently positive and they get tested, and kind of within that 90-day time frame, it is not recommended to get another test because you know, it doesn't mean much to get retested, and we're not asking employers to request a negative test to return to work. That has gone away with CDC, and it's really that you've been isolated for the correct amount of time and you're asymptomatic.
Just jump in for a second on that, just to say that there is now data that suggests after that time frame, the amount of virus that actually is still present, even though it can be detected on PCR, doesn't mean that it's actually transmissible or infectious. I think sometimes people get caught up in that. They're like, but I see the virus, and PCR is a really sensitive test, and so it can pick up dead virus just as well as it can pick up live virus. And so that determination by CDPHE and CDC is based on studies that have kind of looked at the curve of when people have high viral loads, and then taking that virus and see, can it really infect cells?
Thanks, Michelle. Dr. Barron. Along those lines, certainly the Public Health Department and other facilities that Dr. Harrington mentioned have been great resources for people to get testing, but on a little bit of a bigger scale with businesses in town. What is the recommended cadence? And I'd ask probably Roberta and Dr. Harrington what your recommendations are, but others can chime in. For cadence for employers to try to get their employees on. I know that we'll hear a little bit more about resources at UC Health, but at this point, is there opportunity for businesses to get on a cadence with the Public Health Department on testing employees, or what are your recommendations there?
So our community clinics right now are open to anyone that wants to come, with school coming and teachers maybe wanting to get tested. We're kind of in a spot now where we're reevaluating what those community clinics are going to look like, because we do have some resources that we're dealing with to understand what our full capacity is. But I would also have them reach out to some of our other medical providers to see, you know, if they can get tested through their insurance or through some of the programs that are available within our community.
Yeah, we've run into a problem here this month with the testing. The demand is way up for tests, both in our state and nationally. Resources are not necessarily being allocated to the states in an organized way. So when we have these outbreaks in Texas and Florida and places like that, I think that impacts our ability to do testing in Colorado. We now have had turnarounds for a few weeks on some of our tests of over a week, which really undermines the usefulness or utility of those tests. So we've got to prioritize our testing. Our first priority is going to be diagnosis in terms of what we do in public health, and in the medical community is diagnosing people with it. The second one is going to be case contacts, issues where we have disease outbreaks. We want to track those down. We have been doing surveillance testing through the summer to try to get an idea of what our disease is doing here. That is not going to be the same priority now as our diagnostic testing. And then screening, which is something we do in public health all the time. But we've got to critically look at how we prioritize things. So in our community, say last week, we reported that we did 449 tests. There are 2,400 students in Steamboat School District alone. There is no feasible way that we can test all the students, that we can test all the employees, that we can do all the testing we want to do in our community. So as we head into what we expect to be a higher demand season for testing, we're going to have to prioritize what we're doing. I should add that this conversation so far is focused on PCR testing, which is one type of testing. That is molecular type testing. We have another type of molecular testing involving antigen testing. That is just coming mature. I've commented about this before in that there are some truly point of care tests coming out. The Sofia Quidel is one example. But unfortunately with those, well, so one thing about that, there's different tests and we have to be cautious about them. The viral load differs from where you obtain the specimen, whether it's posterior nose, anterior nose, pharynx, or saliva. Saliva being the lowest viral load for all of those. And those tests, therefore, have a much lower sensitivity. But I know that clinics in town are looking at ways of getting those so we can actually have true rapid point of care tests, but I fear that we are still a good couple months away from any significant volume in our community and make that a significant factor in what we're doing here.
And if I might add, and maybe Dr. Harrington and Dr. Barron can chime in as well, but testing isn't the end all be all. This is a tool. Yes, we have it. Is it the greatest tool? Maybe not so much. We've got prevention methods. So in a workplace, ensuring that your workers are wearing masks, they're washing their hands. How many times have I said we need to wash our hands more? They need to be cleaning and disinfecting their areas. We need to make sure in our workspaces that people are distanced and not working in groups, not meeting together in groups. These are all tools that we have. The testing part is one that we do have available, but I wouldn't say, oh, if my employees can't be tested, therefore I have no idea. If you are following good public health measures in your workplace and following those, we're going to be able to keep virus spread at a minimum.
Yeah, and I totally agree with her. I think that's something that's really important, that even if you did have unlimited testing, it's a snapshot. So it's on that day. And so depending on where they are in terms of their illness, if they are ill, they may test negative and then the next day develop symptoms and have enough virus then that thing can be detected. I think even somebody that's symptomatic that has a negative test, you still have to sort of think through like, well, what is their risk factor? Could they still have COVID with a negative test? Absolutely. None of these tests are 100%. So I think that's where what alluding to Roberta said, making sure people are following those rules is so important. And I think a really great example that's just now been published is it was in the news in Missouri, the hairdressers that were positive, and they actually did an analysis of the 151 people that they actually exposed. Now, everybody was wearing masks. That's like a big deal. Is that both the hairdressers and the people they were cutting their hair were wearing masks. They followed them. Almost all of them they followed symptomatically. None of them developed symptoms. About half of them were tested, and all of them were negative. So hairdressers get pretty close to you. And so in terms of exposure, that was something that should have potentially led to a lot of cases, but was mitigated by the fact that they had their masks on and they were probably doing good practices because that's what they're supposed to do when they're in these settings. So I think that's a real life example of how important this is, and where testing would have not changed anything in terms of what we looked at.
Great, thank you. And just for our non-medical people that are joining us, the PCR test is the one that goes up your nose, correct? Yeah. And I would like to now switch on over to Sonia, along with Lori and Dr. Barron, to discuss the UC Health Employer Solutions Program for those really diving into what UC Health can provide for those employers looking for additional support and guidance that may be available.
Yeah, so I'll start. I don't know where.
Sonia, do you have two on? Logged in twice?
Great, can you hear me now? How's this?
Good,
Okay.
good.
Thank you.
Thank
Sorry
you.
about that. So good morning, everyone. Thanks for having us, and thank you to the Chamber for putting on this event. We think it's really important just to provide support to you all as employers. We know that opening up your business and preparing for your customers through reassurance strategies is the key to your success. So given that this is new territory for all of us, please know that what we present today is based on what we know today and will likely change as our environment shifts. I think you're all aware that that's definitely happening and things are changing very frequently. So we have the same goal. We want to ensure that all of you as businesses and employers have a plan. And the main thing with that plan is to make sure that it's communicated to your employees so that they know you're focused on their safety in the workplace, and just so they know what will happen if there's a symptomatic employee, or what will be the guidance as far as employees returning to work. And I think just to reiterate what Roberta said, it's a plan that focuses on what we know works, and what we know works is mask compliance and proper and frequent hand hygiene, social distancing, symptom screening and tracking. This is what prevents and reduces the spread of infection. So we do have Lori here to present to you a little bit on some of the business support aspect that we have, but our goal is also to ensure that we can deliver on our offerings. And so while we'll present this, ultimately what we would do if you're interested in what we present today is we would start with introductory calls with each of you, just to ensure that we can meet your needs, given the resources and the ability for us to provide the services that we're going to present to you today. And this is something that we've already initiated with several local employers. We have had introductory calls already, and we've had actually a few of our employers in the community commit to some of the program elements that we're going to share. And so with that, I'll turn it over to Lori and to Dr. Barron to go over some of the services that we can provide.
Great. Dr. Barron, do you want to speak about testing, or would you like me to start?
Why don't you start, and then I can sort of jump in after.
Okay, perfect. And as Sonia said, thank you so much for allowing us to spend just a few minutes today talking about our COVID-19 Employer Solutions Program. Over the last 4 to 5 months, we've had several employers across the state of Colorado and business leaders asking for our support and guidance in how they can either keep their businesses open, reopen their businesses, or most importantly, really ensure that their employees and customers feel that it's safe to return and that they have the proper workflows and protocols and procedures in place to ensure that happens. So we began designing a program that was tailored around what we've been doing for our own 25,000 employees since early March, and really tailored it to fit other businesses across the state of Colorado. And our focus has always been to help reduce the risk of transmission and minimize the risk of exposure for our own employees in our health system, and those, of course, that we support through our program. There's a couple of ways we can do that, one of which is really increasing your understanding of your employee's health status, and we can do that by testing, as we've discussed today, either PCR or antibody testing, and we can also do that with one of the components of our program, which is our employee screening tool, which, as we mentioned, is really important that you are checking your employees' potential exposure, symptoms, and potentially their temperature every day before they're coming in to work. So a few components of our program would include the virtual employer clinic. And that virtual employer clinic is composed of an employee screening tool. And as I said, this can be accessed through a secure login with an employee's My Health Connection account, which is available through our UC Health mobile app. And each day they can log in and securely attest to their symptoms, exposure, and record their temperature. And then the employer has the ability to run reports on that for compliance and auditing purposes. And again, that is all secure through our UC Health mobile app and their own My Health Connection account. And then a big component of this program is our 24/7 RN triage line that was stood up and dedicated to this program. And it is staffed by highly trained and experienced nurses that have been dealing with COVID-19 since the beginning. And they are following established protocols. So an employee can call in and be triaged, assess. If testing is necessary, then testing can be ordered. When those results come in, the employer receives them through their My Health Connection account. And then we also follow up. And of course, if that test is positive, then based off of the current CDC guidelines and our recommendations, we would either quarantine or isolate that patient or employee and then get them back to work when it is safe to do so. And then of course, if they're negative, we would guide them on return to work guidelines as well. And we can also provide the test results to the employer. Once the employee has signed the proper consent forms, those can then be sent to the provider, or excuse me, to the employer securely through a provider connection account. One other important component of our program, and I'm just going over a few of these at a high level and happy to go over these, all of the components of the program in a follow-up call with anyone who's interested. One of the other important components is our virtual behavioral health. We understand that COVID-19 has taken a significant emotional and physical toll on the well-being of workforce across the entire country. And so we want to help provide the support services that employees need. So this is the same type of service our own UC Health employees have, and we're providing this 24/7 behavioral health service for anyone participating in this program at a certain level as well. And so your employee would have access to a licensed therapist 24/7. After that initial assessment, then we can determine if they would need follow-up visits, and those can be scheduled virtually. And all of that is then billed to the employee's health insurance, or certainly we can direct bill the employer if that's what you'd like to do as well. And then again, finally, an important component of this program is, of course, the expert guidance and support that we can provide to employers as they continue to navigate this ever-changing landscape that we know as this pandemic. And so again, please don't hesitate to reach out. Our contact information will be available to you. We can help customize a program with all of these things in mind to ensure that you feel safe bringing your employees back in and your customers feel safe returning to your business. Dr. Barron?
Sure. And so just kind of going back to what we've already sort of heard about, the changing landscape available right now may not be available even within hours or even next week. It literally is that chaotic where I wish I could say that we had consistency, but it really has been very consistently inconsistent. Is the best way to put this in terms of what we're told we're going to get. Sometimes supply-wise gets shifted to another place. Some centers have had issues just having the supply, not even the testing reagents, but swabs, pipette tips, things that you sort of don't think about in terms of like having shortages of. And so I think in terms of the testing, certainly if we have availability, I think we'd love to be able to access and have everyone tested. I think prioritization, certainly if they're symptomatic or have had exposure, that has to be a high priority just because it has second and third order effects it potentially could have affected and has implications for everyone, the workforce, the people who live at home, the community at large. And then from those levels, I think we can figure out potentially where we're at, what we have, and if there's individual organizations that feel strongly that they want to do some type of testing to potentially help figure out what makes sense for you, realizing again that it's a snapshot and can't be used in isolation. Still got to do the screening. Still got to do the symptom checks. You still got to have people use. And I think that's sort of a really important piece of it. One thing that we're certainly working on that may be a benefit, we have not perfected it yet, is doing pooling tests. What that is when and they look at, they do an HIV testing, but they take a group of people, and instead of running the test individually on everyone, they combine samples of, say, 20 people. And then if that's all negative, then you're done. You don't have to do 20 tests. If somebody's positive, then you do have to take out the 20 samples and then figure out which one was positive. So our lab has been working on that process. It looks like it's going to work, but they have not perfected it yet. And obviously, we don't want to send this methodology out as an option until we know it really works consistently. You're making this, hopefully not in isolation, but you're using this generally as sort of some of your screening. That might be something that will help facilitate volumes, because if you can combine them into, 20 or whatever it can accommodate, get that many more tests done in a reasonable frame, rather than having to run them separate and then hoping you're in the queue at the head of the queue to be able to get them done. So that's something that I think for certainly low risk asymptomatic, if that's testing that is being requested, that's something we could consider hopefully in the near future, but it's not quite where we want it yet. And again, we want to be able to ensure that when you get those results, that they are indeed as accurate as we are telling you they should be.
I'm just going to put a plug in for the app that you mentioned. So I'm a private physician, but I work at the hospital. And so when I go to the hospital, I do this quick screen. And so I'll just show folks, this is what it is on my phone. It's 3 questions and it's a temperature. I put that in, I get a green check mark, and I go flash that by the front desk when I walk through the hospital. And so it's a pretty easy deal. And to some degree, this symptom check process can be a little bit of a nuisance. But I am aware of instances where people have been discovered with it. And it's just part of that deliberate process that I think all employers need to have in place, where they're trying to catch people before they enter a workplace with symptoms or if they're developing them.
Great, thank you. Sonia, anything else from your end on that?
No, I mean, I think I want to just reiterate what Lori said. If anyone is interested, we're happy to have some dialogue and discussion, and just to hear from you all. What are your needs? Is there something that we're not thinking of? But I think some of the the benefits that we are able to offer can be very beneficial in your workplace. So we appreciate that opportunity and the ability to maybe customize a package for you that works best for your needs.
Awesome, thank you. Thank you to the whole UC Health organization for standing that up, and certainly to the public health department. They've also done a tremendous job of supporting employers as well. So a handful of different options there. There are also a number of questions from employers as to positive cases, and what happens when we hit X number? Does that mean everything shuts down? Dr. Harrington and Roberta, can you walk us through kind of the process at which we may or may not shift into different stages? What are those triggers, so that employers can really feel like they have a handle on what could or could not happen?
Right. And so as also an occupational health nurse and industrial hygienist, I get really passionate about worker health. And, contingency plans. Businesses need to have contingency plans. This is an OSHA regulation to have emergency action plans. So anyone with over 10 employees needs to have this documentation already prepared, and should have had this prepared before a pandemic. Looking at CDC and CDPHE guidelines, if you have more than 2 employees that are sick with COVID, that would be considered an outbreak in that facility. So it kind of depends on the industry, how we would look at that and what recommendations we would give to that facility as to if they needed to shut down or not. We've got some of our long-term care facilities, those are, and some of our medical facilities, those are probably a lot different than maybe a restaurant or another retail business. let's say. So, we would definitely look into the situation, see what's going on, and provide recommendations at that time. But again, I do encourage people to have those contingency plans. What if you did have to shut down again? How would that look? What would you be doing? And the guidance is still out there that if people can work from home, that they still should be continuing to do that. So Dr. Harrington, I don't know if you want to add to that as well.
Well, I'll just comment both from the individual employment perspective and from the community perspective. So as Roberta mentioned there, if you have a case at a business, you are supposed to shut down the area where they work for 24 hours and clean it. I mean, there's these guidelines, and we've kind of talked about this through the pandemic. If you have 2 cases or more, then you start talking about the business. So it's important that people, throughout this pandemic, I've talked about people need to manage risk. What risk can you tolerate? So if you have one individual who's the only person that does a key function in your business and that person gets sick, how are you going to continue your business if that person is sick? But then we have the community approach. We have tended to lag behind state numbers, or maybe not lag, but the state has had other areas that have been worse hotspots for infection than we have. So it's always possible that if the state has a rising rate of disease or reaches a critical point, that the governor and the state will impose restrictions. That's entirely possible, and we've seen that through this pandemic. But then locally, if we reached a couple critical marks, so those critical marks that we tend to follow are the case positivity rate and then the case per 100,000 rate. And those both give us some indication of what the disease transmission and prevalence is in our community. If we got to a critical point and we discovered on Wednesday that we had a number that reached that, I would not advocate shutting things down on Thursday. Rather, what we are supposed to do is then impose new things that might mitigate the spread of that disease over the next, say, couple of weeks to give us time to see if we can get a hold of it. So it would not be a kind of one-day notice, okay, here's what's happening. But if we failed in that effort and we had a high or rising level of disease in our community, then we would be forced to make changes. And I don't yet have kind of maybe I've avoided this, making a list of what our steps would be, but we can all look at how we unfolded our shutdown, and it would be something in reverse of that. We would look at the areas that have high transmission risk, whether it be gyms and places where people are breathing hard, whether it be eating areas where we have an opportunity to get the virus in us, and gathering sizes. So I think there'd be layers to the onion. It's not that we're going to do a bunch of things at once, but on the other hand, if you're at an untenable position and you accept to have a different outcome, you can't just not do anything. That's that definition of insanity, right? So we would have to come up with some action plans.
Thank you. And I think just having that understanding and awareness that it's not this like magic number that we're working towards, it would have to be, a week or so or more than that to see a trend. I think that's been really reassuring to certainly our community as a whole, but employers as well when we're talking at that higher level community wide potential of some closures.
And the numbers I pay attention to is a 5% test positivity rate. And then this 10 cases, this average kind of daily 10 cases per 100,000 number. Those are both numbers that we pay attention to. And again, it's not an absolute, okay, we're over the cliff if we get there. But yet, I think those numbers would force us to make some kind of action to try to change the trend of the infection.
Thank you. Now I'd like to shift over to Tina. Lots of questions for you around paid sick leave requirements. Certainly in Routt County, we have a lot of small businesses. And so throughout this, just keeping that in mind as you certainly know, and how that differs up here. Can you start by walking us through what employers need to do in regards to paid leave if an employee has a positive COVID test? And also, as Roberta walked us through, if an employee, for one reason or another, is under isolation, they don't have a positive test, but if they're under isolation, what is the employer responsible for? I think mainly in regards to pay and leave and all of that. If you could walk us through that, that'd be great.
Okay, well, hello, everybody. I see some names I recognize on the chat and in attendance today. It's nice to have you here and nice to be here with you. A little different from the medical side. We'll talk about the employer leave responsibilities here. And I'm going to spend time on the Healthy Families and Workplaces Act, and we'll also talk a little bit about Families First Coronavirus Response Act, which we've been living with for a while. So Healthy Families came in at the very end of our legislative session, which was bifurcated due to COVID. And of course, when the legislators reconvened, COVID was paramount on their mind, and that's where this came from. So the law was effective July 15th and is in place now. Pretty much all employers are covered. So sometimes laws are just for the private sector, sometimes the government and special districts get looped in. This is public and private sector employers that are covered by this, but not the federal government. So to the extent we have some of those employers in the region, they are not covered. And there are really 3 phases to Healthy Families. The first phase that we are in now goes from July 15th to the end of this year. And it's not requiring much new for our smaller businesses, right? We are, for the rest of the year, having to comply with the emergency paid sick leave requirements of the federal Families First Coronavirus Response Act. So that federal law has been in place since April 1st, and that covered employers with fewer than 500 employees. So again, that's going to cover most of us. If we have employers on the call and in the region that had more than 500 employees, 500 or more, now they are covered by the emergency paid sick leave components of the federal Families First Coronavirus Response Act. How it might impact you as a smaller business in the region is that the Families First Coronavirus Response Act had certain exemptions to providing emergency paid sick leave that are not accounted for in the Healthy Families and Workplaces Act. So there were exemptions, or there are exemptions under Families First for small businesses, so businesses with fewer than 50 employees, where providing leave would jeopardize the viability of that business. So some of you may have taken advantage of that. There are also exemptions for healthcare providers and emergency responders. And again, those are not accounted for in the Healthy Families and Workplaces Act. So we think that means that the smaller employers and the healthcare provider and emergency responders are at least going to have to do the emergency paid sick leave piece. And that is 2 weeks of leave. That's not the 12-week FMLA expansion leave. That's another section of the FFCRA that, again, you may be subject to, but if you are in the expanded group, you know, you can still, you're just under the emergency paid sick leave portion. So that's what's in place this year. Beginning January 1, 2021, employers with 16 or more employees are going to need to start providing paid sick leave under the Healthy Families and Workplaces Act. And then all employers, so smaller employers with 15 and fewer employees, will be subject to the Act's requirements January 1 of 2022. So if you have 15 or fewer employees, you can be on, after the December 31st, 2020 hits, you're on pause, getting ready, and have another year break. But if you have 16 or more, you're getting ready to comply in January. The paid sick leave requirements are different depending on whether there is a public health emergency declared or not. Of course, we have that in place now. I'm suspecting we still will have that in place January 1 of 2021. In the case of no public health emergency, the emergency paid sick leave accrual for all employees is 1 hour of paid sick leave for every 30 hours worked. It is capped at 48 hours per year. So that's not quite a full year of accrual. An employee is full-time, part-time, temporary, seasonal folks. Again, not federal employees because the federal government is not covered, and not employees covered by the Railroad Unemployment Insurance Tax Act, which is going to be very many. Accrual starts with the beginning of employment. You can, if you have granting systems, do a grant instead of accruing, as long as the grant would satisfy the accrual requirement over the course of the year. Employees can use paid sick leave as it is accrued. So sometimes you have limitations on your sick leave that in the first 30, 60, 90 days, people cannot access that leave. If you do, then that won't work with healthy families. You must allow use upon request. Request can be oral, written, electronic, or whatever other acceptable means you allow. What's kind of funny about healthy families is it says you can have a reasonable notice policy, but you cannot discipline people who don't comply with it. So, if you want to go ahead and put that in place, you probably have a call-in procedure already. When it's healthy families leave, there isn't a recourse if people don't follow it. So the use in the regular context is for just what we use sick leave for. I'm sick, my family member is sick, I need preventative care. That's the usual stuff. But it also covers if my employee or my employee's family member is a victim of domestic violence, sexual assault, or harassment. If I need to seek medical attention, victim services, relocation, legal services, counseling, that is new. You probably don't cover that under your sick leave now. A family member is, again, what you expect, somebody related by blood, marriage, civil union, adoption, but it's also a parent who is well, it's a person who stands in place of a parent for a child. So this is in loco parentis concept that you may have heard of. So if I am taking care of a child, I have day-to-day responsibility for their care and financial support, and the parents are not in the picture, then I can take leave for that child, as well as I can take leave for someone who stood in the place of my parents for me when I was a minor, taking care of me. And then this curveball that got thrown in is a family member is any person for whom the employee is responsible for providing or arranging safety-related care. So since that is in there, this, again, we don't know how far that goes. That's going to expand it beyond family. In a public health emergency, employers have to supplement paid sick leave at whatever point the employee is at, up to 80 hours for full-time employees. And if it's a less than full-time employees, it's going to be based on a 14-period schedule or average of how much you have to supplement. So whatever they have, you don't have to add, you just add to that up to whatever their threshold is. And then this leave would be available for that isolation, for the need to seek medical attention, for care for a family member seeking diagnosis or with symptoms or exposure, and to care for a child or other family member, so this is new, whose school or place of care is not available due to the public health emergency. So that's quick, I know. And I know there are questions.
Yep, there are a couple. Just really quick, going back on the paid leave employer, that is, you also have to do that if somebody is in isolation, they do not have a positive, but they've been required to stay at
If
home.
they have a healthcare provider's recommendation, which I heard from the folks earlier, they're going to get, if they are symptomatic at all, or there's a recommendation for a test, yes, that will be covered. And I should have said, let me just, I see my note now, that if you have leaves that already satisfy Healthy Families requirements, you don't have to do anything extra. But as we heard today, there are some things that probably aren't included in your leave policies, so you should have them reviewed. to see what tweaks need to be made if you're going to use an existing policy.
Great, thank you. And then in terms of, we've talked a lot about how encouraging as many people as possible to continue to work from home. That's the case for some, it's not the case for others. If some people can work from home and they have an isolation order or they have COVID and they're feeling up for it, how does that play into leave requirements if people can work from home? Certainly if they're feeling horrible, they shouldn't be working.
Right. I think if they can work from home, I think we administer that as we usually would. That is there maybe isn't a need for leave in that situation, but it's going to be very case by case. So I think we have to work with the employee, and we certainly don't want to put pressure on them to work when they're sick. So that presenteeism stuff hopefully is going away with what we're running into here. But yes, I would say that if they can work from home, that's okay to do, and then they would be getting paid regular wages rather than paid sick leave in that instance.
And as we are heading into the school year with a much longer lead time, knowing that it will be hybrid or probably less, the kids will be home more. How does this play into that in regards to how many hours need to be provided since it's such a longer time frame?
Right. And I think this is going to be some of the toughest stuff, the high risk employees and the employees who are parents who can't work because they need to provide schooling or care to their kids part-time or full-time. So Families First is in place through the end of this year under the federal law. And when the Healthy Families and Workplaces Act paid sick leave components take effect January 1, again, for the 16 or more employers, there's going to be another bucket of time. And I do think it's going to be 80 hours because I think we are going to have the public health emergency in place. I don't think it's just going to be the 48. And that's not going to be enough. So I do think we got to be thinking farther ahead. What are we able to do? I mean, I'm having conversations with employers who are thinking about on-site childcare, and there's some issues with that, right? They come up with that. Can we provide some split schedules? Can we provide some flexible hours so that people can work around maybe their child's work day, even if it's not full-time? What are we going to do in the long haul to not lose these pretty valuable employees who are, due to these circumstances, needing that additional time off?
Thank you. And just shifting over to a couple of the questions that came through, can you repeat what the cap is again on how many hours? I think per month, it was 1 hour per month up to 36.
The accrual rate
Yeah.
is 1 hour for every 30 hours worked. So full-time people will accrue it faster than part-time, temporary, seasonal folks. That's the same for everybody. The cap is also the same for everybody. In a non-public health emergency situation, that cap is 48 hours of accrual and use per year. So a lot of our sick leave and PTO go way beyond the 48 hours. Maybe not for people brand new, but for people who've been with us for a while, certainly. And then again, if a public health emergency is declared, we're supposed to supplement whatever they have in that paid sick leave up to 80 hours for a full-time employee, and again, up to an average, a 14-day average for your less than full-time people.
Thank you. And does the Employers Council have kind of a summary version cheat sheet for employers that we may be able to access? There was a question just to a recap of the information that you shared because it was really valuable.
Yeah, we do. And we actually have been putting our coronavirus resources in front of the login on our website, employerscouncil.org. So if you go to that page, you'll see coronavirus resources, and you'll see information on both Families First, because that's still going on, and the Healthy Families and Workplaces Act. Also, the Department of Labor has a poster that you should have up now, and it's a half and half poster. It has the Healthy Families on one side, and it has the Public Health Employee Whistleblower on the other side. And they have a couple of fact sheets 6A is for this year, what we need to do, and 6B is for into 2021, 2022, what employers need to do. So those are good resources. They're on the Colorado State Department of Labor website as well.
Great, and we'll be sure to send out a link to Employers Council and to that. And also we'll share information on the UC Health Employers Support Program. We have just a couple minutes left. I think there are some questions coming through right now. And Helga, have you gone through? Do we have any summary of some of these?
Yeah. So a couple of, does an employee need something from an official health provider, or if they just say, I have symptoms, but I haven't gone to see anyone, what happens in that case?
That might be for me for leave. I
Yeah.
guess I'm not sure. Documentation has been an issue, right? We're not supposed to be bugging healthcare providers to get all the stuff that we might normally get. You know, for our leaves, especially extended leaves as employers. So once you have notice, of course, you've got to act as described today, and you can get the name of the healthcare provider who has made the recommendation for that. Under the Healthy Families, if somebody's going to be out for 4 or more days, you can ask for documentation. So that's into next year. Families First just says name of the healthcare provider that's making the recommendation, or the agency that's putting the isolation order or quarantine order in place. In a public health emergency under Healthy Families, no documentation can be required of the need for leave.
And what about people who travel to a high risk area and come back? Are you still required to do all these things, Tina?
Well, this is a tough one. A lot of employers are asking about putting travel restrictions in place, or when employees go to certain places. I think it's going to be difficult to manage, frankly, difficult to enforce. I think we're going to have to rely, as Roberta said, on those good preventative measures that we have in place. You know, Colorado does have a lawful off-duty activities law that says you can't terminate people for doing stuff that they're legally allowed to do, and travel is one of those things. So you're not terminating them if you're requiring them to stay home for 14 days. You know, the first person who tells you and gets sent home for 14 days, I guess we'll see if other employees tell us what their travel plans are. That's going to be the challenge. So can you have them? Yes, you have to administer them consistently, and in no circumstance could you terminate for just that reason.
And Tina, just to add on to that too, I think some people, what gets a little bit sticky is workers' compensation and compensability. And if it was truly something that was acquired in the workplace versus something that was community acquired. And I think that's a difficult thing right now that we're getting into, especially with community spread. I mean, we've seen that with influenza. And where did you get your influenza? Was it at work or was it at the grocery? So I think that gets a little bit difficult for employers as well.
Yes, it does. You're absolutely right. And I guess I'm telling my members that if there's some indication that they could have contracted, they think they contracted, you know, there's a difference between what's reportable to workers' comp and what's compensable. And so I would say from an employer's point of view, if there are facts and circumstances that seem to indicate that there could be workplace exposure, especially for people, of course, in the healthcare arena and other closely working with people who have COVID arenas, go ahead and report it and let the carrier sort out compensability, because that is it's a safety net system. It's important to have. It's also a protection for employers. If it falls under the workers' compensation system, there aren't other legal claims that an employee could bring against the employer, like a negligence or a premises liability kind of situation. So we have that system for a reason. So use it.
Thanks, Tina. For the Healthy Families Act, is sick pay calculated? How is sick pay calculated for tipped employees? And then for the Healthy Families Act, is it 16 full-time employees or 16 employees no matter their designation?
I will follow up with the tipped person because it's a little bit of complication there. So you can reach out to me at tharkness@employerscouncil.org. You know, there is something for commissioned in the law for how you factor that in, and that's complicated, but tips are also complicated. So let's work on that together. The other question was, I'm sorry, Angelica, could you repeat?
Yeah, for the Healthy Families Act, is it 16 full-time employees? That's the limit,
yes.
or is it 16 no matter their designation, part-time, temporary?
It doesn't matter their designation. So you're counting all employees carried on the payroll, even those on unpaid leave, and you're actually counting all employees across the United States. So for purposes of determining when you're covered, if you've got people in other states besides Colorado, they may be counted as well. However, your need to provide leave would only be for your Colorado folks.
Okay, and then I think I have one more question here. If someone uses their PTO for vacation and now they don't have any time off for self-isolation, will employers need to provide that sick leave up to 14 days to supplement their lack of PTO?
They will. So that is the piece that if you're going to use an existing policy, right, that's a little bit of the chance you run that somebody's going to use that for other purposes. So that might be a reason to have a separate Healthy Families Leave Act bank of time so that you can track when it's used, so you know how much you need to supplement and you can take credit for what you already have provided. But yeah, the act says on the day a public health emergency is declared that employers need to supplement whatever they have up to, for a full-time employee, the 80 hours.
Thank
And
you.
I'm gonna jump in. There was one more question kind of along those lines. It's just, is it a one-time annual or kind of through the end of this year of having to provide that time, or is it every, if there were multiple occurrences? Hopefully that's not the case, but it kind of goes back to the school leave too. It's just not having enough time.
It is one time. So it's not, and so again, that's why I say it's going to run out. It's not of every occurrence. And the 80-hour supplement, right, that the public health emergency leave can only be used for 4 weeks after the public health emergency ends. So presumably some of that supplemented leave can be rolled back once that public health emergency is no longer in place. The logistics of that are not clear in the act, and certainly we're hoping for more guidance from the Colorado Department of Labor and Employment on that.
Thank you. I know there's one more question just regarding changes in requirements. Dr. Harrington and Roberta, do you see any changes happening in the near future in terms of higher levels of occupancy, either in vehicles or in restaurants or retail?
I wish I could predict the future. And, you know, with this virus, you know, we seem to not be able to make future predictions on this. And the more we can do now to suppress this, that hopefully we can come to a point where that might be possible, but we have to work in the here and now with what we're dealing with and make sure that we're doing everything we can. And I also wanted to add, that people need to be getting their flu shots as well, because that is also in this whole discussion that will hopefully eliminate the influenza from the differential. So if someone is sick with influenza, by getting your flu shot, it's going to lessen those symptoms. Maybe we don't have symptoms at all. It's going to really help our healthcare providers. And I encourage employers to ensure that their employees are being vaccinated this year.
I just want to tap onto that, just not just flu shot, but all immunizations that maybe they got missed. So certainly there were a lot of appointments over the last several months that got canceled, and certainly with kids might be behind. We can certainly say across the nation, if you look at vaccination rates, there's been a dip because of these missed appointments. We certainly don't want a measles outbreak either. So flu for sure, and then anything else you need, it would be really great time to get those scheduled.
Thanks.
And we've kind of sputtered along through the summer here with a moderate level of disease, but it's been manageable. Our resources have not been overtaxed. We have capacity right now to deal with things. But as I said earlier in the week at our Board of Health meeting, I've got two growing concerns. We have schools starting, so a new factor. And as we get into the fall and winter season and people are indoors more and other factors play into it, we get into the cold and flu season. So those are variables that are changing and are likely to increase the risk of disease in our communities. So this is the time now for businesses and everybody to kind of reinvigorate their disease prevention stuff, which is what this talk is about. How do employers, schools, everybody do that? How do you prevent disease? You look at how you can have people working at home. You know, walk your way through this. We did this a couple months ago. It's time to do it again for everybody. And I mean, I have confidence that we can continue to do well, but it won't happen by chance. We have to make our own luck. So let's prepare for success. Look at our workplaces, schools, and all places, and reinvigorate our disease mitigation efforts and prevention activities. And as stated, vaccines are just one of those. So, yep, lots of things we can all be doing.
Great. And ideal time to get the flu shot by?
So they always trickle in this time of month. This is a year that I would encourage, and I bet Dr. Barham would agree, earlier than later. Don't be waiting this year. Get your flu shot. Yeah, pharmacies, because they're big buyers, tend to get them before the private clinics do, but most of us private clinics get them by the end of August. So I would encourage this year, let's just take flu off the table. We need to save our resources for COVID and for employers, to the point of this discussion. As already mentioned by Roberta, get rid of one of the causes of coughs and fevers and all. Yep, when we get the flu vaccine in here, let's get it going.
It's never too early.
Okay, good to know. And we are over time, so we'll wrap up and just offer, start with Sonia. Any last comments you want to share?
No other additional comments. Just thanks again. We appreciate the opportunity, and we're here to support you in any way. So thanks, Chamber, for putting this on. Appreciate it.
Thank you. Lori, any last words for the group?
No, I just echo Sonia. Thank you so much for allowing us to provide the resources and discussion today. And please reach out if you have any questions.
Thank you. Dr. Barron?
Nope, just get vaccinated and stay safe.
Thank you. Tina?
I think I've talked enough today. Thanks for listening to me, and follow up if you have questions.
Thank you. I really appreciate it. Roberta?
No, thanks. This was a great forum. I also wanted to make people aware of a resource through the American Industrial Hygienists Association. It's called Back to Work Safely. And there's guides for many retailers, different small businesses, gyms, great guidance on what to do in your space. And these documents are evolving, and they're really good resources for businesses.
We'll be sure to track that down and get it out as well. And Dr. Harrington?
No, I have nothing else to add. Just
Okay. Mask up.
yeah, mask up. Yeah, remember the 5 commitments, everybody. Right? Wash your hands. Wear a mask when in public. Socially distance. Stay home if you're sick. Get tested if you're sick. I mean, do the things we know. In fact, if you do those things, just those core things, we could probably be highly successful with this disease prevention.
Thank you. Thank you all. I know that you are working more than around the clock, whatever that could be, and to make time to help our employers here in Routt County. We so appreciate it. So thank you for everything you're doing all the time, and especially for being here with us today. And thanks all to the attendees. We'll be sure to get follow-up information out ASAP. Have a good Friday.